When we're talking about health issues in men, we're talking about half of the population on the face of the earth. And we're going to neglect half the population. We're probably not doing ourselves a great service in terms of figuring out solutions to the various problems we have.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week's episode is titled Man Up to Reproduction, Fertility Insights, featuring Dr. Joe Alukal. Hey, everyone. Welcome back to the show. Today, we're going to be talking about a topic that's not talked about enough in general. It's talked about a lot on our podcast, but in general, and that's male fertility. And we're very fortunate and lucky to be joined by Dr. Joseph Alukal to discuss this subject matter. So, Dr. Alukal, thank you so much for joining the podcast. Why don't you give our listeners a quick introduction?
Sure, Kevin. Thank you for having me. Again, my name's Joe Alukal. I'm a urologist on faculty at Columbia University in New York City. I'm the whatever. I don't want to bore our listeners with all this, gobbledygook, but I take care of men's health here, male fertility, male sexual health, and I direct our fellowship. Those are probably the two roles that are most relevant to what we're talking about today. Thank you guys again so much for having me.
Thank you so much. You've been a leader in our space for a while, and we're lucky to have you on. And let's just get right into it then. So you, Kevin, and I all know that male fertility has been neglected, and it's a very stigmatized topic, both in society and within the medical community, especially given its significant role in couples' infertility. So why do you think that male fertility is so stigmatized and has been neglected by all of us for so long?
Sure. Justin, it's a great question. And I mean it when I say it. Like, I don't think of these things as being kind of like abstractions or manufactured like tempest in a teapot sort of issues. When we're talking about health issues in men, and we'll start with that bigger picture umbrella,
Right.
I want to remind everybody, hey, look, we're talking about half of the population on the face of the earth. So like if we're in the US and we're talking about things like healthcare expenditure or access to care, or prevention of disease, and we're going to neglect half the population, 150 million people, we're probably not doing ourselves a great service in terms of figuring out solutions to the various problems we have. And so with men's health issues, that could be things like prostate cancer diagnosis. We just got through, we're getting through right now to the end of Prostate Cancer Awareness Month, September, and have been talking about this the whole month. And it's, again, the sort of thing where, unfortunately, men being who they are, there are barriers to getting men in and getting them diagnosed and getting them to treatment. Okay. Male fertility exists in the exact same space. We're just talking about kind of a continuum, a spectrum. Men, as we get older, the health problems that we encounter depending upon where we are in our lives, what ages we are. Why would it be more likely that women with a fertility problem are going to seek and avail themselves of care than men with that fertility problem? And there are some actual, real, tangible explanations for that. It's not imaginary. Okay. We certainly know that no demographic utilizes healthcare resources less than men between the ages of 18 and 45, followed closely by men between the ages of 46 and 62. Next is, yes, men contribute meaningfully to fertility problems. So couples who embark on family building, it's 1 out of 6 of them who are going to technically fit under the definition we've constructed for being infertile. They're going to try for a year. They know what they're doing. They're timing their intercourse and they can't get pregnant. And then hopefully they'll go get seen by a doctor. Of those 1 out of 6 couples, again, not an insignificant number at all, it's just under 50% of them who will have an identifiable male factor. Okay. A quarter of those couples, 25%, where it's the guy alone who's got an issue. Another quarter where both the male and the female partner have an issue. Okay. So that's not an insignificant number at all. We're talking about a common problem. And when we get into specifics, and we might later on in this talk, that could include a discussion of men with a 0 sperm count for genetic reasons. That's 1 out of every 100 men. Like if later this fall, if we went to the big house to watch the Michigan-Ohio State game and that place seats more than 100,000 people and a disproportionate number of fans are male, imagine that there's 1,000 men in that stadium who have a zero sperm count for genetic reasons, non-obstructive azoospermia, and many of them won't know about it. Okay? So it's not an insignificant problem at all. But why aren't people getting care? Why aren't people talking about it? Why aren't men aware of the treatment options that exist for them? And I think it actually does have some meaningful overlap with, like, why don't guys come in to talk to a doctor about their prostate? Why don't they talk to their buddies about their prostate? Why don't guys talk to each other about erection problems? And thankfully, that one at least has changed because of like so many things that have happened in our society in the past 20 plus years, 30 years. But these are private problems. People don't like discussing them with strangers, that's for sure. For different but related reasons, they don't like discussing them with friends very often. And lastly, there is this relationship between a woman's reproductive health and a doctor's office.
Yeah.
That a woman, when she goes through puberty, some other woman in her life is going to tell her, honey, I need to take you to see the gynecologist. And you need to see that person once a year, especially you need to see that person once a year once you start being sexually active. Nothing comparable happens to a guy. And so as guys get into their 20s and 30s and 40s and start to encounter these problems, they're still sort of wondering on their own, like, do I have to talk to somebody about this crap? Like, what could I do differently where I didn't have to embarrass myself and maybe I wasn't going to get misled by somebody? Or, maybe this problem, whatever I've got, is just going to go on away on its own, please God. And so there's nothing about any of what I just described that is imaginary or inexplicable or difficult to understand. It's just that's what we're working against. And yes, we have to continue to work against it and for a whole bunch of reasons that I'm sure we're going to talk about today.
Joe, that last point was fantastic. Justin and I was talking with another guest yesterday, and that was that exact point that we harped on. Females in the pubertal ages, you're plugged into the system, and it kind of starts, you're going with it. Guys, like, I was asking Justin, like, hey, do you know who your PCP is? I'm guilty myself. I don't know who my PCP is.
I do, actually.
Oh, okay, good for you, Justin. You learned something.
I mean, even primary care is that's important as well. Absolutely. But I mean, hypertension is not quite so loaded a topic as male fertility.
Right. Correct.
Yeah.
I mean, listen, every guy wants to picture when they're growing up, they picture themselves as a provider, a family, like a family man, a father. Yeah. And when you're unsure of whether that's possible for you because you're struggling, a lot of guys don't want to face that reality. And instead of going to the doctor, they tell their wife to go to the doctor and they don't do a semen analysis. We see it all the time. Guys, after 2 years, just refusing to give a semen analysis, they finally get it. And it's like, what have we been doing?
Yeah, so there are multiple layers to that too. Imagine those guys when they're teenagers. Again, this young woman is being led by the hand to the doctor's office, to the gynecologist. You can recall hanging out with your teenage friends and one of that group of guys, for whatever, they're going to regret it reason, uses the word ejaculate and everybody else starts laughing.
Yeah.
There's no joke in there anywhere. But on the other hand, it's an inherently funny word to a group of 15-year-old boys. Okay. That doesn't change when you're talking to a 35-year-old and now he's alone in the room. His group of friends are not there, but they're the first group of people he thinks of when you say something to them like, you're going to need to go to this place and masturbate and ejaculate in a cup.
Dude, you nailed this. I never thought that.
And, you can see it.
We're giggling over here.
Like there's something, they're like, is this funny? Is this not funny? Can I laugh? How did I end up in this mess? Like, why am I here? And so really all of those things, are just piling in there every time we've dragged one of these poor souls into our office. And I have to remind people all the time, look, I'm trying to help you. You can feel free. If you need to have a good laugh and you want to get it out of your system, it's totally okay. But then we got to figure out, or if we want to share some jokes and I can make you laugh for a bit, that would be great because I hope it will help you relax. But after that, we got to move on and get this sorted. Like, we need to get the data, figure out, do you have a problem or not? And if so, what am I going to do about it to try and help you? People appreciate that. They need to know that I'm not like looking at them, judging them. And I'm not. Like, I get it. This is an unfortunate circumstance to find yourself in. Well, let me help you try and find your way out of it.
So Joe,
That was really mine. Go ahead.
yeah, that
Kevin.
was fantastic. That was awesome. So like, let's segue that in. So for guys who are starting the family plan, you got a guy here. What are some key steps that they can take to be proactive about
Sure.
their reproductive health?
Sure. I do think we have to think about this differently for like men and the environments they find themselves in. Okay. So Justin, for example, practicing in a major metropolitan area, myself in a major metropolitan area, people don't lack access to doctors like us, right? But imagine somebody in Panhandle, Florida, for example. He may not have ready access to a reproductive health specialist. It might not even be totally straightforward for him to find his way to a urologist. Okay. So I want people to be thinking instead about, all right, based on where I am, what are the things I could do to help me figure out, again, do I or do I not have a problem? Right. So that person could see a urologist in their community and start with some simple tests that would tell them if they had issues that urologist will feel comfortable doing. A physical exam, it's embarrassing. You know, just like it's done in the movies, got to drop your pants, turn your head and cough, but it's a few uncomfortable moments. And to the best of my knowledge, everyone has survived those moments in the history of the world. 2, a urinalysis, a great screening test that, you know, all urologists are capable of doing that are going to help you figure out things like your risk of certain cancers, the likelihood that you have diabetes that you don't know about, a condition that overlaps with both sexual health complaints and fertility problems. Some hormone testing, simple tests like a testosterone and an FSH, which that urologist is going to know how to do, can give you a lot of clues about, hey, do I have an issue here? And lastly, a scrotal ultrasound, which again, that urologist will know how to set you up for. Maybe you got to go to a radiology office. Maybe that person can do it in their own office. But at the end of all that, I'd feel really comfortable telling a patient, even if he hadn't had a semen analysis, hey, you know, you've probably got a clean bill of health. That's good news and a good place to start. Now, why don't we figure out where you and your partner have to drive to find a fertility specialist for her? And maybe if that's Panhandle, Florida, maybe you do have to drive an hour or two. Both of you are going to go. But when you get there, be prepared to do a semen analysis.
Yeah.
Okay. Now, instead, in a metropolitan area, I would just tell this guy, hey, you're going to see one of us. We're going to examine you. We're going to take care of all that testing. We're going to tee you up to do a sperm count. And let's do that sooner rather than later, because this is a time sensitive process. If you told me, look, man, I backburnered this crap because I didn't want to deal with it. I had too much stuff going on at work. I hated the thought of it every time it came up. So I just put it on hold and I came back to it 5 years later. But it turns out that my wife in that period of time got 5 years older and she also got a lot angrier. And between A and B, she went from 38 to 43 in age. I would say, dude, you did yourself no favors because her chances of getting pregnant now are fundamentally different than they were when you guys started this process 5 years ago. There are very few things in medicine where we can say to somebody, look, there really is a time urgency to this. And those 2 ages I put out there, I encounter in New York City all the time.
Mhm.
You know, luckily there's places around the country where the average age of both partners is far less than what I might encounter in Manhattan on a given day. But I still want people to understand the reason to tackle this sooner rather than later is again because your partner's odds of conceiving change as time goes by. No way around that. Short of egg freezing, which, you know, we're probably not going to get into today. But I would want to make sure that people understood there is a reason to get this done sooner rather than later. And alongside that, why would it hurt? I mean, I know it's embarrassing and it's time that you've got to spend on doing this. But at the same time, we get the information back and either you get a clean bill of health, which is great news, and you can move on and stop worrying about this, or we find out that there's something there we need to address and we get a jump on taking care of that sooner rather than later.
Yeah, I think that this is really important. I do think that a lot of the things that we discuss, and then one thing that is really important that you harped on here is time. Time is really, really important when it comes to fertility, less so for the male, but much more so for the female. And if the male is the issue, they can make an issue for the female.
Yeah.
And you know, this is something we've discussed before, but it's what, you know, couples infertility, especially male infertility, is one of the only diseases or issues if not the only one that I can think of where if a male is struggling with it, the female partner has to have the treatment oftentimes.
Yeah.
And so addressing these things, not necessarily for yourself, but for your partner, should be a motivating impact. And I think Kevin has always talked about, when it comes to time, you also need to understand that lifestyle measures, if you're doing them incorrectly, take time to recover from. And
Yeah.
Kevin's talked about this before, saying, listen, if you're talking about changing lifestyles, it doesn't happen in a month. Sometimes it doesn't happen in 3 months. These things take time. And the sooner you can go to a doctor and identify those issues, the more time you have to make those changes without compromising your fertility journey and your family planning.
Yeah, for sure. Lifestyle's a huge one. I mean, no matter what it is, if it's a procedure that we've done, whatever it is, the human body takes almost 3 months to make new sperm. So I tell people it takes us some time to turn that battleship. Okay. Like we got to start that process now, but we can't anticipate getting a payout in terms of seeing your sperm count numbers look different for minimum 3 months. And maybe it will take longer than that. When it comes to making basic lifestyle interventions, I want people to understand, look, there's a couple reasons to do that. One is, again, that delayed payout. It could help you in terms of your numbers, and that will in turn help you in terms of your chances of getting pregnant with some intervention that might be less than it would have been otherwise, or if you hadn't made these changes. But alongside that, when this works, when you guys have a baby at home, that lifestyle intervention you've made is part of how you stay a healthy part of that family. If that's
Good point.
quitting a 2 pack a day cigarette habit, that's finding a way to vape less, if that's less alcohol, if that's less marijuana, whatever it is, if that's exercise, diet, and weight loss. And all of those things, we're confident like healthy living helps with reproductive function. There's nobody I've ever seen who said, man, I drank your Kool-Aid and that was 6 months ago and I managed to lose 20 pounds and I quit smoking completely and I drink an awful lot less and I feel a million times better. There's no one I've ever had say that to me who in turn, like a semen analysis got a lot worse. No, never. It's always the opposite. It's a simple intervention. It's just people have to be patient because it takes time, but there is this huge secondary payout of that guy's now healthier as he embarks on actually bringing home his kids. We've done him a meaningful health favor. I can, look his partner in the eye and say to that person, hey, you know what? I absolutely know that he doesn't have testis cancer. He doesn't have diabetes, that we've started him on some healthy living behaviors that are going to hopefully stick with him. So I feel confident that we're giving people good care. That's good medicine. So I don't have any hesitation selling this as hard as I'm selling it right now. Like it's good for people. It's good for half the population on the face of the earth, half the population in the United States. We should be banging this drum loudly.
And I also always tell my patients too that, we talk about, 3 months to start seeing some changes that you're making from a lifestyle, but we don't make habits overnight. I don't
Yeah,
just all of a
right.
sudden be like, hey, I'm
I
going to
quit
start
today.
going to the gym every day. No, that
Yeah.
takes time in itself to make a habit. So it really is a little bit lengthened time period beyond that before you're really going to start seeing some of these realizations. So now we've been talking about time a lot. So Joe, is there a, time frame when men should start consider seeing a doctor, or like is a 20-year-old guy have a different perspective versus a 30-year-old guy?
Yeah,
What's the time situation?
I do. I think my views on this maybe again are a little bit influenced by the nature of my practice in New York City. Like, couples can be older when they uh, get around to sort of starting this process. And so I tend to tell those couples, what can it hurt for us to gather the data sooner rather than later? I know the textbook or the internet might have told you, hey, give it a year. I think if I was someplace else in the United States, and the average age of my couples were in their early to mid 20s, I could feel comfortable telling some people, well, hey, you did get a normal physical exam from me today, and you gave me a urinalysis, and I feel comfortable that you're otherwise healthy. Why don't you guys go home and make sure that you're properly timing your intercourse and give it 6 months or a year? But I think if I say that to two 20-year-olds, I'm not burning any bridges for them if they come back to me in a year and they're like, Well, we followed your instructions to the T and we're still not pregnant. Okay, go do a semen analysis. And what you're doing in that case is maybe you're minimizing, the use of a resource that doesn't need to be overused by some of these couples. I'm not sure that there's that much harm in there if you did just send them. Certainly, if that couple told me at that first visit, we're both going to be losing sleep about this for the next year, I'd say then don't. Let's do the testing. She can go get checked out. You should go do a semen analysis. But I don't have to be as sort of like forceful about telling them you should do this sooner rather than later, which I am with my couples who are in their late 30s or early 40s. I'm like, look, if there was some reason you couldn't be bothered to do this testing before now is the time. We need to do it and to figure out where things stand before too much more time goes by.
Kevin, I'm going to let you give your opinion here because I like your spiel here. I agree with Kevin here.
Well, so for me, from my perspective, we're living in a world where we have such great access to data. I'm not going to name company stuff, but like you could hop on the internet now and order a semen analysis.
Yes, we did. Yeah.
That can be delivered to home. And so for me now, I was telling Justin about this, again, I was laying in bed and I was like, you know what? I want some labs. There are websites, companies out there that you can get all this data almost instantly. And so I'm a big believer that we're moving into a time where if you want that data, as long as the messaging's out there and patients are aware that it's possible, I'm a big believer in getting that information. I don't know, Justin, if you have different thoughts, or Joe.
Yeah, Joe, I'll let you go first and then I'll follow up.
I can't disagree with that. When we're talking about great platforms, I don't know how much I should be promoting any one company or another, but I'm a huge fan of Fellow. I've known those guys since they started.
Yeah,
we're a fan of them.
I'm thrilled. New York being New York, it was the only state in the union that did not have any sort of Department of Health approval for the utilization of that test in the clinical setting. So if a patient of mine lives in Connecticut or New Jersey and he finds that website on his own, he could use that, bring me a report, but I couldn't suggest it to them. I couldn't order it. And so only very recently do they have any sort of deployment in New York because they were approved for post-vasectomy sperm testing. Okay. But I'm still thrilled to even have them in any way, shape, form, or fashion in my clinic after having talked to them for 2+ years. But at the same time, I'm waiting for the other. I can't wait for them to be available to patients who simply need a semen analysis as a diagnostic test. And you got to understand, I'm probably 20 years older than the both of you. So I still live in the last century and I forget all the time that patients will come in having figured this stuff out on their own. Doc, why aren't you suggesting that I do this? Because I read about this on the internet or social media told me I could do this. Are you clueless? And sometimes, yes, I am clueless. But I mean, in that case where there's basically no inconvenience and no embarrassment to the patient, a minimal cost and a highly accurate result, I've got no problems gathering that data. It's just, again, if I'm talking to 220 somethings and that guy's like, I'm really embarrassed about this entire thing. Be like, just make sure you understand how to properly time things and give it a year and it's okay. The other guy who says, I looked this up and I want to go home and do this test and I live in Connecticut, I'm going to tell him, go do the test and email me the result once you have it in your hands. And then last is, I'm not going to give any wiggle room to the older couples. I'm just not.
Yeah.
And I think I agree with your broader picture statement, which is how can we be hurt by data? Either we know or if we don't know, we don't know what we don't know, right? Whereas if we know, we have a capacity to either establish we're in a problem situation or we're not. And if we're in a problem situation, what are we going to do about it? I can't fault somebody for saying that to me and wanting to gather the data.
Yeah, no, I agree with both of you. I really like Kevin's point. I do think that this younger generation for sure is starting to understand this aspect of themselves. And I personally think, and I've seen it, Kevin's in LA, you're in New York. I'm sure you guys see, younger people coming in, starting to be interested in their fertility. And like you said in the beginning of this, your fertility is a window into your overall health. So anytime you're willing to go to the doctor, I'm all for it because if we can detect an issue, you've already, it doesn't have to even be a semen analysis. Just coming in, we're going to discover something about you. So I think if you're interested or considering family planning, or you just want to know your fertility status, it's never too young to go see a doctor and learn about your health.
Yeah, and don't get me wrong, that's a great point. Like what we were talking about was presume the couple is sitting in front of you.
Yes.
If somebody is listening to your guys' podcast and they're like, my wife and I've been trying to get pregnant for the past 9 months, and I have no access to doctors and I never see any doctors, I would absolutely tell that listener either A, get in front of some doctor,
Yeah.
like be it your primary doctor, anybody, to make sure that you don't have other health issues that could explain why it is you guys aren't pregnant. Don't wait an additional 3 months. Figure it out now. Okay. Or yes, go do a test like Fellow, because that also, just as you say, is a meaningful window on that person's health when he's had no windows on that before.
Yeah.
When his last health checkup was a sports physical at age 18, when he played, basketball as a high school senior.
Yeah.
No, there's not a window. There is a room and it's dark. There's no light lit. There's no door open. There's no window open. And so that is the person where I would much rather we shed some light on this and data can tell us something. If that guy's semen analysis is not perfect, I would be telling him, and I know the people at Fellow would be telling him, go get checked out. And the reason is there are health issues you might need to know about alongside this other question of how will I get my partner pregnant? How will we have our children? Have to do it. There's no hesitating on that if you're out there and you're listening to this.
Yeah. And I think that one of the reasons for hesitancy is that men do feel uncomfortable, as you said, going to the doctor. And I think you already explained to some degree how easy the fertility workup is, but can you just highlight that again for our listeners? Like, what does a typical male fertility workup include? Because as we all know, it's really not bad.
Yeah, no, I think if you're talking about somebody who has access to, any of us in a major metropolitan area, super easy. The only things you have to worry about, time commitment of getting to a doctor's office, copay, a little bit of embarrassment. That's it. And at the end of it, we're going to have done a physical examination. We're going to set you up for a semen analysis, and we're likely going to check a hormone test, which is a blood draw and needs to be done in the morning. At the end of that, I know everything I need to know about the guy's reproductive health. Yes, in my office, because I'm a stickler for some old school stuff, given my age, I'm going to force almost all these guys to do a urinalysis unless they've had one within the past years. And then, yes, there's some meaningful percentage of guys in my practice are going to get sent for a scrotal ultrasound. Or when I'm doing telemedicine visits with people who, maybe do live 3 hours away in upstate New York, I might route them to a scrotal ultrasound as a first step before I could get them in front of me physically to see them. But not everybody has to have that done either. And so we're really just talking about a visit, an exam, a semen analysis, some blood tests.
It doesn't get easier than that. And
Yeah.
it's not, I was talking to Kevin, listen, most of you guys, you're jerking off 3 times a week, 3 times a day anyway. You might as well give us a sample. That's all
Just,
I'm saying.
There was one guy years ago, like I've had so many people I've sent for semen analysis over the years, like, doc, this sucks. I hate doing this, doc. This sucks, doc. And then one guy who came in, he was like, man, I think there's an opportunity in here. And I was like, I want to hear this. Like, this is like 10 plus years ago. He goes, I have these weeks at work where I don't ever see the outside of my office. We're talking, 80-hour work week is a good week for me. And most weeks it's 120 hours in that damn office where I'm ready to kill somebody. Do you know how excited I am to walk out of there and to go to that lab, know that I'm going to shut the door and I'm going to have 15 to 20 minutes to masturbate by myself without anybody else around, knocking on the door, sending me emails. I could look at some pornography and I can go back to my office. I'd have paid them $2,000, let alone $200. The first time it happened, I walked back. I was on cloud 9. And then I was thinking, do I get to do that again? When do I get to go back there? We need to set this place up. I was looking at this guy. I was like, man, you're working too hard. Okay? Like, I know that's not helping. I know that there's plenty of other New Yorkers in the same boat who are ready to sign up for this model. But I don't think I can endorse your semen analysis / chicken wings place in downtown. And he goes, chicken wings, that's it. We need to have wings downstairs. We've got it. We're doing it. We're doing it tomorrow. It's like, let me get you and your wife a kid and then come back to me after that and we'll talk about your startup idea.
That's awesome. I mean,
that's perspective right there, man.
Yeah. You never know, right? I just needed 15 minutes and an opportunity to masturbate.
We're simple.
That's
We're simple creatures, to be
Yeah,
honest with you. We really
absolutely.
are.
At the real, we really are.
That's a truthful story, right?
I'm not going to disclose which famous investment bank that guy worked for.
Oh man, this is too good, too good. Hey, so
Ugh.
listeners, you heard it, man. It's the workup. It's easy, a little bit of embarrassment, but it can be done. It could lead to startup ideas, obviously, as you
Right,
know. With
exactly.
So, Joe, let's how do we we've talked now about the stigmas. We've talked about the embarrassment that guys have. So, how do we shift the cultural narrative so fertility becomes seen as like a truly shared responsibility, rather than just primarily a woman's issue?
Well, I think one is actually doing what we're doing right now. I really do. I mean it. I think it's something that and the same with screening men for prostate cancer, whatever, discussing erectile dysfunction and its overlap with other health issues. It is just reminding the guys that we talk to, we are all men navigating this together, getting old together. And last I checked, there's only one alternative for all the patients who've ever said to me, Doc, don't get old. And I turned 50 very recently, happy to get there. And I'd be thrilled to get another 50 years because I know the alternative. And I've seen that happen to my patients as well. You stay in one place, you take care of people long enough, and you get the privilege of holding their hand as they go through many far more serious things. And so I want to remind people, hey, you're not alone. Okay. This is absolutely something that I am more than happy to try and add some levity to, help you understand that it's not the end of the world, and help you through whatever it is that we've got to find and deal with. So maybe that makes it easier for you to take steps forward. And that could be as simple a step as walking into one of our offices. Next is to remind people that we actually have great treatment options. We have things now to offer the patient with male fertility that, I'm not kidding, didn't exist when I was starting medical school. Not talking about ancient history. Well, I mean, maybe it is ancient history now, but
No.
no, but the notion being that we are making progress, and in that progress, we can offer people treatments that will help them have a higher likelihood of concluding this process successfully. Okay. So they shouldn't be daunted by this. Instead, they can enter into it with some hope, hopeful that we're going to help them solve their problem. I think the last piece that's super important for all of us to keep in mind is the reason these issues are so private and personal is because they are that important. Okay. So I want people to understand, hey, we're going through this now, but there's a goal. And at the end of the day, that goal is you're going to bring another life into the world, and then you're going to be responsible for taking care of that life. And, having navigated 2 of my 3 kids to college, can't believe that one. And, God willing, we'll get the third there. It is one of those things where that also is part of that same journey. Happy and proud to get to 50, happy and proud to someday, I hope, get all 3 of them out of the door and to something where they have a chance to be successful and happy. That also takes a commitment. And that commitment, I'm far better able to understand at this point in my life than I could when I was a 20 something and my wife and I were pregnant with our first. She would get angry if she was listening to this, and I claimed to have played any role in that pregnancy in terms of the physical burden. And I know she's right. But yes, I've been there for all of that and consider myself incredibly lucky to have been there for all of that. I want people to understand the weight of that. The weight of that is all about saying part of my responsibility to these people isn't just showing up for the right events and saying the right thing when something bad has happened or giving them the right advice when they get a bad grade. It is doing the right stuff to keep myself in the game such that I can be there another year and do that for them, or to model for them the correct behaviors that they need as they get older. That's a responsibility. I welcome that responsibility. I will help you to understand that so you welcome that too. We're super lucky. We're super lucky to do what we do and be able to make an intervention in people's lives that can be lasting. I plenty of years in the same place. To run into my patients with their kids is always just a gift. But the crazy part is now some of those kids are older, and I'm just like, geez, I saw them 12 years ago. I can't believe that, yeah, that happens with time. Well, yes, you've helped people accomplish this massive milestone in their lives, and that will continue to stay with them and be with them for a long time. Put them on a good path while you are there offering this intervention for them. That's never going to be doing them a disservice.
When people talk about fertility, the focus almost always lands on women.
About half of infertility cases are actually due to male factor infertility, but that really doesn't get the awareness it should.
Project is flipping that script. Their fertility and family building benefits include men from the onset, with access to semen analysis, urology consults, and expert support along the way.
And here's the kicker. When employers are offering benefits that bring men into the family building picture from the onset, it doesn't just help families, it leads to healthier employees, less stress, and big healthcare savings.
Fertility care isn't complete unless men are part of it too.
Learn more about how your company can start offering fertility benefits at progeny.com/talk2HR. That's PROGYNY.com/talk2HR. Yeah, I mean, the way that you describe that, it kind of puts this idea in my head, fatherhood starts before conception.
Sure, it does.
Fatherhood starts when you decide that you want to become a father.
Mm-hmm.
And that includes taking care of your partner, being accountable to your partner, and being a provider just, in that moment that leads up to conception, leads up to having a child. And I think if you can change the narrative to be that way, where, hey, listen, you want to be a father, you got to start acting like one now. You got to be responsible for yourself. You got to be responsible for your future kids and your wife or your partner. I think that may be a good way to frame these things. And honestly, that just came from this conversation right here. I've never thought of it that way. And I think it's a really nice way that you put it. And I think that because that idea of fatherhood is so important, like you said, to so many people, I think if we can describe it in that manner, I think it makes a lot of sense.
Yeah, it's important. People know that too.
Yeah.
Very profound, Justin. Very profound.
Thanks. Sometimes stuff comes out of my brain. I don't know, but let's change.
That's why we're recording you.
Yeah,
we just, whatever it is.
It was for that moment right there. That moment right there.
Right.
I had it for a second, and now I'm thinking about the ejaculating guy again.
Yeah, right. Or the chicken wings.
It's a fleeting moment. It's a fleeting moment in time. All right, Joe. So obviously we've talked a lot about the workup. We've talked about the stigmas, but what is one thing that you think guys don't know about that compromises their fertility? Something, like kind of underwear that you wear or things like that. I mean,
Sure.
Is there something that really you see a lot that people aren't aware of?
Yeah, I mean, I get a lot of questions on this front, and like maybe again, I might have some different or more old school answers, but like when people are asking me the questions sort of at the end of the visit, and I know they've been hesitating, and they're like, I really need to know, doctor. It's like underwear is one of them, cell phone in their front pocket's one of them, laptop heat is another one. And my flippant answer is always, look, if any of these things worked as well as the internet believes them to work, we'd be using them as a contraceptive device. Okay.
Sure.
Now, when I say that as a joke, I mean that as a joke because actually one of those was worked up as a contraceptive device. Some French researchers tried to come up with a super tight pair of underwear that did diminish sperm count reliably. And lo and behold, it worked. Like they could get people to azoospermic by increasing the temperature of their testicles.
Wow.
Yep. But of course, you're not surprised to hear this. The issue was compliance because nobody wanted to wear their goddamn device for 3 months plus. Right. Yes. And the second you took yourself out of this contraption, presumably to have sex or do something, maybe take a shower, you're wondering, "Hey, shit, like, is this going to stop working because I took the thing off?" So obviously it never came to market, but scientifically speaking, it did work, which I find fascinating to this day. But the point is, yes, like most people can't do enough damage in terms of a heat exposure with regard to diminishing sperm count to where I would say that's playing a meaningful role. And like guys will ask me, Doc, I get a schwitz a couple times a week, like it helps me to think more clearly. I go to a bathhouse or I go to a sauna. I'm like, keep doing it, especially if it's relaxing to you. Absolutely. Keep doing it. Different when I get a guy who's like, Doc, I'm a welder. I've been a union welder for 25 years, and I have an acetylene torch between my legs at 1800 degrees for 8 hours a day, 4 to 5 days a week, most weeks. That guy, tell him, I hate to say this, I probably need to tell you to find another job, but I mean, like, I can't. I know that. So, like, we got to figure out how bad things are and, like, what can we do to work around that? That's different. That's the sort of heat exposure where I think it's very real. But heat is one in general, and heat is actually where we would fit all of the things I just talked about underneath it. I don't know that the RF signals we're getting from our cell phones are super dangerous, but might I be disproved by some future study? Of course, that's possible. Oh my gosh, if we're talking about things that people don't know are deleterious to their reproductive health, testosterone replacement. Oh
Yes.
my dear goodness, how did I almost forget that? Like, guys who come in all the time and are like, but my buddy does this and my buddy has 3 kids and I just started after like struggling to find someone who would give it to me and I feel a lot better. And what do you mean that taking testosterone is going to screw up my sperm count? I thought testosterone helps sperm.
Yeah.
And so I've heard physicians say this to me. They're like, "What are you talking about? Testosterone would interfere with his sperm count. That doesn't make any sense." Like, you just have to trust me that you missed this day in medical school.
Yeah.
And I had this explained to me many, 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 many times throughout residency as well and fellowship as well. And I'm right. Like, when you take testosterone, it shuts off the hypothalamic pituitary gonadal axis. And the result of that is that guy's testicles stop doing any of the stuff that they're supposed to do. They don't make their own testosterone. They don't make their own sperm. And that's the only 2 jobs they have, and they relate to each other. So deranging that process will upset this apple cart big time. And if you don't believe me, check his sperm count today and check it again in 3 months. It's going to be a lot worse.
Yep.
And so
100%.
patients, yes, we have options. We know how to give them treatments that can bypass that and jumpstart that same hypothalamus pituitary gonadal axis I just alluded to. But you got to put yourself in front of us and let us figure out, one, did you have some problem that necessitated you being on testosterone in the first place?
Yeah.
Were you just taking it because you wanted to hit a golf ball farther? Or were you taking it because you really felt different from other people around you, because you are different from other people around you? We can discern that. Probably your other doctors, unless you have a really good endocrinologist, they can't discern that. 2, if you are supposed to be on something, let us choose what that is, and we'll put you on something that's going to work and isn't going to screw up your sperm count.
Very true.
I'm
Very
preaching to the
true.
choir here, though. So I mean, like,
Yeah.
well, we have a listening audience, so hopefully they'll hear this, and this might get some guys in front of one of us to get sorted if they thought, hey, I was taking this stuff, I thought it was going to help me have a kid, and
Listen,
it's
we're
not.
LA and
Can never
Miami,
say it enough.
everyone's on TRT.
Yeah. New York, yeah.
I mean, that's the double-edged sword with all this. Like, look, Justin and I just did an episode talking about direct-to-consumers, which probably have come out by the time you guys hear this. But it's great. It's great, the access that you get for patients out there who may have longer waiting times to get into the conventional office. But this is the big problem, right? Guys who are, in their 20s, 30s being put on testosterone. And Justin did a great study on that, looking at this. Even if they do mention that, hey, reproduction or their fertility potential is important, they may still get put on it because that messaging was not clear, or that, that risk was not reviewed. Right, Justin?
6 of the 7 companies offered me tea, despite me having a T of 675 and desire for fertility. So,
They didn't believe
Yeah.
the numbers when they looked at you, though. They're
Yeah,
like,
no,
"Yeah, no,
yeah,
six."
this can't be right. This is a test error. You know, I mean, I'm always saying to people like, look, you need to understand this is a bullshit test, okay? But like, that's a different one. You know, when I see somebody with a level of 675, I'm like, you're good. Don't worry about it.
that's what I'm saying. Thank God I
Yeah.
was 675. Otherwise, the study wouldn't have been good.
Yeah, right. What am I going to do with this T level at 295? Ah!
Yeah, exactly. So obviously there has been this. We've kind of gone to this place where there is this emotional toll that fertility has on both patients, the male
Mhm.
and the female. How do how do partners support each other through this process? Because
Wow.
it can be a very invasive process, sometimes for the man, but often for the female partner, obviously as well.
Yep. And sometimes both, and so like, I just, that is a tough one to watch people navigate. And I do think one of the things that, again, I've been privileged enough to observe over the years are the couples who do a really good job of just supporting each other. And that's in distinction to the couples where, it's obvious. And I can't say anything and I can't judge people and I can't get in the middle of these conversations, but like the couples where people are blaming each other. And boy, oh boy, marriage is tough. Like, if you want to talk about things that have been said in podcasts before that were wholly and entirely self-evident, didn't need to get said out loud. Marriage is tough. Like the notion that like you have to take on challenges together, keeping in mind that you have different backgrounds and you have different approaches to problem solving and you have different perceptions of what the problem might be. And inevitably, the problem has something to do with something that is important to the both of you, right? If it wasn't important to the both of you, it's not a problem. And so here is something like crucially, centrally important to the married life of so many people who choose to get married. They say to themselves, well, I found this person. We're going to become a couple. We're going to be a couple forever. And someday we're going to have a family. How do they grow that family? Presumably, with exceptions, obviously, by having children. Okay. Yes, of course they can adopt. Yes, of course there's donor gametes. Yes, of course there's a million other ways that you can grow a family now. But at the same time, the idea is, with some exceptions, someday this family will be larger than just the two of us. So then to find yourselves in a moment where people are telling you can't do that. Yes, I understand why sometimes a person's first instinct is to ask the question, well, why can't we do this? And is that their problem or mine? Well, the truth of the matter is, no matter what the test results say, that problem is ours. Like unless we're thinking about this the wrong way, that problem is ours. And how are we going to approach it together? I think is a super important way to contemplate that very difficult moment. And so I've seen the couples where the whole issue is that guy with his zero sperm count for genetic reason. Those people are devastated. They are really, truly devastated by this. And they're devastated that the byproduct of them being this way is that their partner will have to go through all these treatments and they will have to go through treatments that might not work. Um, but I think in those moments, if their partner is saying, hey, we're going to get through this, um, it helps to keep that couple moving forward as a unit.
Yeah, it's fantastic. I mean, we all see it in our clinics. And what I tell my patients is like, look, you guys are a team, right? You guys got together as a team.
Yep.
I'm trying to be here to kind of help partake and help you together as a team, but it's, you guys got here together. You guys got to keep moving forward together. Joe, I wanted to ask you, do you have advice for people? So like, a little bit before getting to this step and like the couples or maybe the wife or the partner who's struggling to convince their male partners to get checked up. Like, what is one thing you would just kind of say to them?
Hey, like, again, having this information is so much better than us sticking our head in the sand. So much easier for him to both navigate this process in terms of figuring out where things stand data wise than it used to be. And alongside that, so much more that we have to treat a problem that he might encounter. I think another thing that has actually been a barrier to people getting this care for years and years has been cost and perceptions about cost. People like being understandably super afraid. Well, if we go down this road, maybe we'll end up with a baby, but we might also end up with a bill in the tens to hundreds of thousands of dollars. What do we do about that? I think that is another thing that has changed tremendously since I was in medical school. Coverage for fertility care, thankfully, is something that people understand should be part of health insurance coverage. It's varying the degrees to which health insurance plans offer that coverage, but it is better now than it was 20 plus years ago. So we're continuing to make progress on that. I would want listeners to know, hey, there's ways to get this workup accomplished in a cost-efficient fashion, and ways to get treatment where a large portion of your treatment, hopefully all of your treatment, is going to be covered. Maybe that shouldn't be the reason that you're scared away from looking into this.
I think that's a great point. And one thing that I think we all have noticed is that the female partner in the majority of these cases actually the driver of the guy getting to that appointment. They're booking the appointment. They're there with the patient. They know more about the patient's health than they know about their health.
Yeah.
And so one thing that I always say is your best ability is availability. And that actually goes for both partners in this situation, right? Guys, if you're going through this, if your wife is going through this, your partner's going through this, go to the go to see the reproductive endocrinologist with them. Be physically there. The female partner, take your partner to that men's health visit. Make sure that they're going, ensure that they're getting all the information, because half the time I've seen guys show up and they don't have their partner. Is like, oh, my wife has all the information. I'm like, all we just got to do though is just talk about your health. But that's the way it is sometimes.
I mean, I like, so much has changed since the pandemic, but like, there's so many of these visits now I do where people are just like, hey, can you hang on 1 second? I want to get my wife on the phone.
Yeah.
And I'm always like, absolutely. Like
Yeah.
if you can get her to FaceTime in, if we can get her on this Zoom call, whatever it is, I know it's only going to help, both in terms of you guys offering me a more complete picture as to what's going on. And as well, there's now two sets of ears that can come away from this and say, I think he said fill in the blank, right? Like, we all get it. You're in the doctor's office. Things are confusing. You don't know what's going on. We're throwing around terms. I mean, like, it helps to have more people, all hands on deck. And so I think that's a super important part of this is, as you say, availability is your best ability. I agree with that. It just helps you guys, again, approach this thing as a unit moving towards a goal. If both of you are involved and both of you are taking notes and thinking to yourselves, okay, we got to do this as a next step, it's just going to make it more likely to work.
Yeah.
All right. So, one thing you kind of just talked about right there, and I think that kind of leads to a nice transition. Talking, and we could spend hours talking about this. So just kind of like a quick summary, but like, cost of fertility care is rather variable, right? You go, depending on states and, where you're at. So can you just give our listeners some guidance, just, very broad, on fertility coverage?
Yeah. So, I mean, I think an awful lot of the workup these days, people can find a way to get it covered as part of their quote unquote regular care. Okay. And so maybe you can diminish some of that upfront cost for the diagnostics that used to exist. The treatments are going to depend upon the nature of the insurance coverage you have. Are you fully covered for all fertility care out to a certain amount of dollars max? Are you entitled to things like 2 or 3 or 5 IVF cycles lifetime? Do you have egg freezing benefits? What are the benefits for the male partner if he were to undergo any sort of procedures? And you guys know this, we're all urologists, but like, this varies when you get to different specialties, in terms of people's understanding of these kinds of things. But there's some procedures that we do that are routinely covered by insurance because they're the correction of a physical condition.
Mhm.
But then there's others that, for whatever reason, historically or otherwise, like if we're doing a procedure to go looking for sperm in a patient, many times because that doesn't quote unquote have a code associated to it, might not automatically be covered by people's insurance. If you're working with an office that has familiarity with this, they can help you to navigate that. Although, even though my office has familiarity with this, there's still a miss rate. So I think in the same way that, like, gathering the data early is smart, why not find out as much information as we could find out sooner rather than later? I think gathering the data regarding your insurance coverage for fertility benefits earlier rather than later is smart. Reach out to HR at your workplace, benefits at your workplace, find out about the insurance package plan that you have. And then as well, like, there's a time of year element to that. Like, now is the time of year that I'm telling my patients, hey, maybe you want to look into whether or not one of the other plans that either of you gets offered at work has better fertility coverage. You can opt into that during open enrollment and be in a better position for the whole year next year. And if it's one of you, not the other one, that person should be the person to take on the insurance for the year, and the other person should get on to the first person's policy. All these kinds of things, they're just common sense things, but they're not immediately obvious to people, especially if they're in a panic. And because we see this all the time, we know to tell people, hey, why don't you look into this? And it can make a big difference. I hate to say it. It can make a difference to the tune of tens to hundreds of thousands of dollars before
Yeah.
it's all said and done.
I think this is so important, and I know that we have all made, I mean, surgical decisions or intervention decisions based off of how much a patient can afford. And that's unfortunately the truth,
Yeah,
right? That you have some stepwise routines that you can go, but sometimes there's a preferred way. But if you can't afford the preferred way, then we go the other way. And, that is just unfortunately the reality that we try to navigate through with you as a patient. And which leads me to the next question, really. We want to talk about progeny and how it's expanding access of fertility care to men. Can you highlight that? Tell us about progeny and what they're doing.
sure. I mean, I think an absolutely great product that is helping to bridge the gap that we just talked about. So imagine that your employer is make it easy on you, a large company that has a great relationship with an insurer for many years, and as such can give good health coverage to all of their many employees, but that insurer has never had good fertility coverage. Progeny as a bolt-on fertility insurance coverage is something that employer can purchase and offer to their employees. And so now they get better fertility coverage than they had through their own insurance without blowing up the whole thing that they've got in terms of a relationship with their health insurance provider. And so that's super important, I think, for getting people to um, better fertility care when it's needed, and coverage for that fertility care, so that good fertility care that is going to help them accomplish this goal does not break the bank for that couple financially. I think it's a super important product. I think it's a need that has really been there for many, many years. Justin, you just alluded to it. I mean, I remember having conversations when I first came to New York City with more than one patient who had, again, a zero sperm count for genetic reasons, and was talking about, for my partner and I to do IVF and for me to do a microtesty, a procedure where there's a chance of finding rare sperm in my testes. If they are there and we don't know if they're there, we're going to have to go take a few collections at our church. And
Right.
I thought to myself, I don't know what to tell this couple to do. I don't have a right answer for this. I have to see what happens to them in terms of what they choose to do, and just to be here and be ready for them if they came back and they said, we need your help. We figured out how we're going to do this financially, and we want you to do this. I love the idea of not having to imagine that conversation anymore. If products like Progeny greater awareness of the massive impact of infertility on people in terms of mental and emotional health. If all of the facets of what we're talking about today, a greater awareness of that and a willingness to address these issues helps keep people from ending up in this mess, I would be thrilled. I'd like to never have that conversation again.
Uh, I think Justin and I completely agree on that point. I mean, look, fertility rates are dropping. The last thing we need
Oh,
is
yeah.
getting access to fertility care being a,
More difficult.
monetary issue. Yeah,
Or, yeah,
that's
for any reason. Yeah. Can't
right.
find the doctor or can't pay for the doctor. Doesn't matter. I completely agree with you. This is not the moment for us to somehow, make this more difficult for people to embark
Yeah.
on this. Should be the opposite.
Yeah, and oh, sorry, Kevin, you were gonna say something?
No.
No, and the inherent thing is just like I truly believe, and I think one of the reasons why we do this is like everyone has the right to try to be a biological parent,
Yeah.
and I think that if I say this all the time, right? If you're going to be a parent, you're going to be a parent one way or another. When you come see me, we'll figure it out, right?
Yep.
Whether it's biological, not biological. But if you come in and you say, I want to do
Want to.
everything I can to become a biological parent, we should be able to provide you with that service. It should not be something where you can, not afford to do. And I think that that's the world that we should be living in. And fortunately, companies like Progeny are starting to offer that opportunity for a lot of people that maybe didn't have that prior. So I agree. I think it's a really really important thing. And to quote my mentor Bob Brannigan at Northwestern, he says everyone deserves their day in court. We have to be able to give them their day in court.
Yeah, sure.
So obviously with the creation of Progeny coming forward, there's hopefully going to be a shift in men's health and male fertility care in the future. But how else do you see male fertility care changing in the next 5 to 10 years?
Well, I think there's conditions that we can do a better job both diagnosing, recognizing, and then treating. Okay. And so I think we're going to get better at managing those patients with a zero sperm count, figuring out who needs what treatments. How do we maximize the success rates associated with those treatments? If it is something like what I just described, a microtessie looking for sperm. We're super proud of Columbia to be deploying AI in terms of the lab utilization of, uh, you know, technology as a means to make certain if there's sperm there to be found, we're finding them. I think that's a step forward. I think alongside that, there are some future technologies that are going to land. That plane is going to come in for a landing, and we're all going to go, "Hey, let's applaud this moment." Are we going to be able to use stem cell treatments to provide people with gametes? Again, something we've been talking about since I was a medical student, and far bigger names talking about in the 80s and 90s when they believed that that was something right around the corner at places like CHOP, Children's Hospital Philadelphia,
Yeah.
and we're still not there, right? But it doesn't mean that we won't get there. We're going to get there. And so I'm beginning to have optimism that, that goal will be reached in 2 or 3 or 5 or 10 years and offer some of our patients who need it a wholly different way to family building. And then I think lastly, I think we're going to be able to finish up the genetics piece as crazy ambitious as that sounds. But like, rather than taking a guess, I tell people right now, it's the equivalent of standing outside of the Target and you can take a guess like how many items are on all the shelves in there if you had a comprehensive inventory. But when I'm doing genetic testing on him to figure out if he has a problem that explains his issue, sending you in there with like a grocery list that's only got 10 items on it.
Yeah.
You can come back out and tell me about those 10 items. Are they there or are they not? And if they're not there, well,
Yeah.
that's our explanation. But it doesn't say anything about the other 9,990 items that were in the Target. And that's what we have to get to. We need a comprehensive inventory of all the things in there that are relating to the issue at hand. And then we can tell patients, hey, wait, it turns out that you do have this issue for a genetic reason. And hopefully, this is what we're going to be able to do about that, given that we have that knowledge. I don't think that's science fiction, and I don't think that's 20 years away. So I've got a ton of optimism. I think we're going to be offering people 21st century cutting edge solutions to these problems very, very, very soon. Um, I recognize at the very same time, not soon enough.
Yeah. Well, Joe, this has been a fantastic conversation. This is awesome. I think our listeners really benefit from it. If there was a listener that for some reason fast forward to this last portion and basically listen to only this piece, if you could give men one piece of advice or some message about their fertility, what would it be?
Don't be afraid to come in and see us. We're here to help you. I mean, we really are. We are here to do whatever we can to help you. And as you get older, that's going to stay the same. 5 years from now, 15 years from now, hopefully you've got your kids. I'd tell you the same exact thing. Don't be afraid to come back in and see us. We are still here to help you as you get older. Half the population on the face of the earth, we're doing what we can to take care of you.
Awesome. Great way to end it. So, so Joe, before we end, anything you want to, any other things you want to say, anything to just promote or anything?
I don't have anything to promote. I'm certainly going to tell you, Prostate Cancer Awareness Month, not afraid to remind, some of our dads to be are men in an age where they could develop prostate cancer. Don't sleep on that. You got to put yourself in front of a urologist in all likelihood to get properly screened for that condition, especially if you have a family history, especially if you're African-American. We're going to come back to this again in November. We're probably a month away. Well, looking at a calendar, we're a month and a week away. I can do some math, and so a little bit. And we're going to be talking then about not just, like urologic cancers, but also mental health issues in men. Certainly an important part of the men's health equation. And so, look, in all these regards, we're here to help you. Just don't, if you feel like you need to reach out, don't stay away. Find your way. Get a telemedicine visit, for Christ's sakes. I mean, that's easily done in this day and age, different from 10 years ago. Talk to one of us and see what we can do to help you.
Beautiful. All right. For Kevin and Justin, thanks for listening as always. Download, subscribe, give us a review. 5 stars is always appreciated. Until next time, have a good one.